Hello, my name is Madison Millard and I'm an occupational therapist here at the Tucson VA. And today's video is to provide you with information regarding what to expect after your shoulder joint replacement surgery. The most important thing we want to make sure you're aware of, as I'm sure you're probably already aware, is your precautions or guidelines, things that you're supposed to follow after your shoulder surgery, things you're not supposed to do. So I'm going to go ahead and let you know those now just to make sure that you're fully aware. Number one, you're expected to wear your shoulder sling on at all times. The only time you should be taking it off is if a physical or occupational therapist instructs you to do so, or if you're bathing or getting dressed. Otherwise, it should be on, even when you're sleeping. You might find it more comfortable to sleep in a recliner for the first few weeks, but if you choose to sleep in bed, we'd encourage you to place a rolled up towel or a pillow behind your shoulder and your arm to keep it protected and to not allow your shoulder to fall backwards. We want to make sure that your shoulder's in the sling at all times so it stays protected and you're not moving the shoulder to allow it to heal properly. In order to get out of bed, you want to make sure that you're getting out on the non-surgical side or your good side. So if that means making arrangements with your significant other or moving some furniture before your surgery in order to sleep on the right side, you want to make sure you do so beforehand. So when getting out of bed, you want to roll onto your non-surgical side. You never want to roll onto the shoulder that you just had surgery on because you want to keep it protected. So when you roll onto your side, you'll push up with that good arm and then get out of bed. Not only does the sling provide a protective barrier to keep your shoulder immobilized, but it will also provide a warning sign for others around you, so they're more cautious and they're less likely to accidentally bump into your shoulder. Next, you want to be mindful, even though you have the sling on, to not move your surgical shoulder. It's important that it stays in place. Gentle use of your wrist, hand, and elbow are okay as long as that shoulder stays in place. You want to make sure that it does not go past your ribs. Although it's subtle, an example of this might be when you're standing up and fastening your pants, your zipper, or your buttons. You may be tempted to use your surgical side, which is okay because you can use your hand, but you want to be mindful that your shoulder doesn't go behind your ribs. So you want to make sure that shoulder stays in place. An example of this is when you're standing up to fasten your zipper or your buttons on your pants. You want to be mindful that you don't allow your elbow to go behind your ribs because that's going to cause your shoulder to extend backwards, which we want to avoid. So when standing up, you can use your hand, but just please be mindful to keep that elbow in place. Don't let it fall back. Next, we want to make sure that you don't lift anything with your surgical side. So don't carry anything more than a pound or two. It's okay to hold something like a coffee cup in the morning or use your TV remote with that surgical side, but otherwise, just avoid using that arm to try to lift anything. Don't get crazy or carried away and try to carry groceries inside your house. That's not okay. So with all of that being said, you can imagine that things that normally seem pretty simple are going to be challenging for the first few weeks while you're getting used to not being able to use your arm, especially if it's your dominant arm. So it might be important for you to arrange to have some extra support, whether that's from your significant other, a neighbor, a friend, or a family member to assist you for the first few days after surgery. In addition to having some support at home, it might be a good idea to have your home arranged properly before your surgery, whether that means making sure everything's free of clutter, clean, organized, your groceries are at home and in place, and you also have some meals prepared in the freezer so you can easily put them into the microwave and cook them instead of having to prepare yourself a full meal. Only having one arm and doing so might be pretty challenging. So now, on the day of your surgery, you're going to be evaluated by an occupational therapist and/or a physical therapist. We're going to be coming into your room to answer any questions that you may have and guide you through some exercises of what you should start doing after your surgery, educate you on how to properly put your sling on and take it off without moving your shoulder, and just making sure you feel 100% confident before going home. If for some reason you feel that you're not quite ready, or maybe you're unsafe going home, the physical therapy team may recommend that you spend a short time period in a rehabilitation center where you get daily therapy to increase your confidence before going home. Now, if there's any questions that are unanswered following this video, please feel free to write them down and bring them into us so we can answer them for you. Now, we look forward to seeing you soon.